So you want to do dentistry, huh? Today I'm going to give you 10 reasons why you might want to reconsider that decision. Hey guys, and welcome back to my channel. If you're new here, my name's Ferris. I'm a third-year dental student currently studying at King's College London, so I know a thing or two about dental school. So today in this video I'm going to be telling you a few of the things I'm not so keen on in dental school and what you should be aware of before you apply. So if you enjoyed this type of video, make sure you smash that like button and consider subscribing. So let's get right in. So I'd say the first thing that I hate about dental school is that it's such a long degree. Now when you're applying, you don't really think about it too much. You're just like, oh, it's 5 years, whatever. They'll pass quickly. But it's only once you start realizing all your mates graduating, especially finishing up in their third years, and then you're just kind of sitting there still doing fillings. At that point you'll sit down and realize like, wow, this is quite a long degree. And it's especially difficult because all your friends are getting jobs and then they're going through their career progression and you kind of see their work paying off from university while you're still stuck doing your lectures, giving in assignments, etc, etc. So I probably think that's something quite big that you should be considering, the fact that it is quite a long degree, so you need to really love it if you're going to consider doing dentistry. The next thing that I hate about dentistry is that you'll very quickly realize that you are absolutely rubbish at fillings or any of the practical clinical dentistry stuff. I remember when I did my first filling and I looked down at my tooth and I was just like, wow, this just looks like a blob's been plopped in the middle of the tooth. It looked really ugly, didn't look very aesthetic. I'll try and find a picture and put it on the screen here somewhere if I do. And as I was looking at this blob in the tooth and thinking, oh, everyone's the same, I looked around at some of my colleagues and I was like, wow, I'm just not very good at this. And at first it can be quite disheartening because you're thinking, wow, I'm just worse than everyone else. But then you quickly start realizing that, you know, that's just kind of how it is with dentistry. You're not going to get things first time. There's a few things that I'm still absolutely rubbish at, but as you go through it, things do improve. But it's still a challenge because even though you're not meant to compare yourself to others, you kind of do. And it's sometimes a tough pill to swallow that there's some things that just won't come to you naturally straight away. So yeah, that's one part of dental school that's a bit difficult. And leading on from this idea of kind of comparing yourself to others, etc., I'd say another thing about dental school that I kind of hate is the silent competition. So no one's actively competing with you or trying to be better than you, but because everyone's quite intelligent and driven and want to be the best that they can, you always feel that there's some sort of silent, unspoken competition and everyone's just trying to one-up you in every single aspect. And I feel that because of that, you need to have a lot of self-confidence when you're doing dentistry, because as I mentioned before, sometimes things aren't going to go your way and there's certain parts of dentistry that can be very difficult and you might spend hours and hours slaving away and reading textbooks, but because of how practical dentistry is, you're not going to get everything first time. And on top of that, you've got to deal with the fact that other people are going to be doing way better than you, and again, this idea of this silent competition. And I feel like you just need to be very driven and have that confidence to be able to deal with that sort of atmosphere. I do want to make it very clear that it doesn't mean that people aren't nice or they don't share notes, etc. But you just always kind of feel there's this pressure to perform. And here's a little question for the dental students watching. Do you feel that sense of competition at your dental schools, or is it only a King's thing? Let me know down below in the comments. The fourth thing that I hate about dental school is the work-life balance. Now granted, I still do think you can have a good work-life balance when you're in dentistry, but there's kind of a bit of small text with that, which is that if you want to have a nice work-life balance, you have to have good time management skills. Dentistry is a very intense course and it's like that for the whole 5 years. And even though you can do things on the side and you can still have a nice social life, you can only really do this if you have good time management skills and you're able to keep on top of your work. And on top of this, it's really easy to fall behind on work, and once you do, things just start piling up and piling up and piling up. In dentistry, I feel like every minute counts, and in order for you to be on top of your work and, you know, feel comfortable in life kind of, your time management has to be A1. And when I compare to some of my friends and their other courses, I don't feel like everyone has that same level of intensity and there's a bit more breathing room. The fifth thing that I hate about dentistry is the fact that it will destroy your back. Now you get given countless lessons and sessions about posture and sitting correctly, but I'm telling you now, if you look at any dental student and ask them to be honest about their posture, they'll tell you it's absolutely rubbish. It's just sometimes really hard to get to those back teeth or get to certain teeth when you're doing procedures without hunching forward and hurting your back basically. Even though I do think that the university does very well in trying to teach us to keep our posture right, it can be very difficult to stick to that, and a lot of the time you'll leave clinics with a bit of a backache and, you know, not feeling too good. On top of this, it's really common for dentists to have bad back pain, so that's something that you have to consider not just in dental school but for the long-term future as well. The sixth thing that I hate about dental school is that you kind of get put in your own dental bubble, and by this I mean that a lot of the time you'll kind of just be close to the people on your course. Now this doesn't mean that you can't make friends on other courses or get involved with societies, etc. But because of the fact that you're in university so much and there's greater clinical exposure as you go on with the years, you're going to be spending 99% of your time with other dental students. So obviously most of your friends are going to be dental students and, you know, it's just going to be dentistry central. Now there's nothing wrong with this and I love my dental student friends and, you know, no hate, but it does sometimes feel that you need to put a lot of extra effort in to get to know people that aren't on your dental course. So that's why I really encourage everyone, if they do dentistry, to get involved with a lot of different societies, not just dental societies, but cultural societies, sports societies, etc, etc. Or else you're literally going to be talking to the same people 24/7 and you'll never stop thinking about teeth. The seventh thing that I don't like about dental school is that there's never one perfect clinical technique. A lot of the time when you're learning something new, when you're learning about crowns, when you're learning about fillings, etc., you'll have your clinical tutors teach you how to do that procedure. But the problem with that is, because dentistry is evidence-based and it's always evolving, there's 100 different techniques to do the same thing. And when you're learning something new, you kind of just want something simple and straight to the point, you know, A to B. But with dentistry, it's a lot more difficult. You'll have one tutor telling you to do it this way and another telling you to do the absolute opposite. And you kind of have to navigate the waters yourself to work out what the best technique is. And obviously I know this whole idea of independent learning and kind of just working things out, but that can be quite a challenge, especially when you're doing something clinical and you really want to make sure you don't mess it up because you're going to be treating patients. You can't be second guessing yourself when you're doing a treatment on a patient. So this is something that can be quite stressful, specifically when you're learning something new. And for someone like myself, I like to understand what I'm doing, and sometimes it can be hard to keep up with all these different techniques. So yeah, that's something that kind of annoys me, but I think with time, as I read more papers and get more comfortable dealing with fillings and, you know, practical-based dentistry, I'll become more confident and that will be less of an issue. But as a dental student, I think everyone has the same frustration when you're trying to, you know, just do this simple procedure and just have one simple answer, but there's never one simple answer to do one thing. The next thing that I hate is the fact that I haven't seen any patients. Now, I know this isn't the fault of the dental school at all, but it's just a bit upsetting that I still haven't seen a patient or done a filling on anyone or even done a treatment plan. I'm well aware that because of the COVID restrictions, this is something that's really, really hard to implement at the moment, but that's just something that's really upsetting, the fact that I just haven't been able to see a patient yet. On top of this, I feel like there's so many soft skills that you develop from meeting your patients. For example, you can read a million books about patient communication, but you'll never actually be able to master it until you get those patients in the chair and you actually start talking to them. And this is a common theme with a lot of things that get taught at dental school, especially when you have an integrated learning course. You're meant to learn the content and then instantly apply it to a patient or to the clinical setting. And at the moment, because of COVID, it's quite hard to do that because none of the patients are coming in and there's so many restrictions. So I'm hoping things improve, but at the moment that's something that I'm hating and I'm really not enjoying. And I know that a lot of dental students across the country are feeling the same, but who knows, things are on the up. Let's just hope the COVID rates drop and patients start flooding in. The next thing that I hate about dental school is the fact that there's so much you do not know. Because there is so much content that you need to cover and because there's so many different things that are involved with dentistry, you will never ever know everything. And on top of that, it's quite frustrating because once you've really started to understand something, you realize there's a new technology that makes it obsolete or a new technique that's 10 times better. So it sometimes feels like you're playing catch up and trying to stay on top of things, especially when it comes to the latest advancements and dental news. And a lot of dental graduates say that you only really start learning real dentistry once you've graduated. I kind of think about it like the same as a driving test. I remember when I passed my driving test and got told that you only really start learning how to drive once you've passed because you're actually on the road and you haven't got that instructor next to you. I think that's the same with dentistry because you have your clinical tutors with you the whole time, so once you're in the big wide world, it's a bit scarier and there's a lot that you have to learn and navigate through. But there is a flip side to this. If you like dental research and you like reading up on the latest advancements, it is quite cool seeing how dentistry develops over a short span of time. And for me, I do find that interesting, but I just do find it quite tedious and hard to keep up with sometimes. And lastly, the biggest thing that I hate about dentistry is histology. I just hate histology. I don't know why. I really don't like it. Find it super boring. And I think it's built upon this aspect of dentistry where because there's so much to learn, there's going to be so many things that you find fascinating and absolutely love, but there's also going to be a few topics and a few modules that you absolutely hate. And for me, anything to do with histology is just like pure pain. And in dentistry, you do have to look at histology quite a bit. I remember in my first year, we had these histology sessions where you had to go in and look at microscopes and different slides. I'd literally just sit there in pain and I'd just wait for the 2 hours to be up. And low-key, I think the only good thing that ever came out of the histology session is that I managed to book some Post Malone tickets once. Maybe if I spent more time focusing on the slides, I would have enjoyed it more. Anyway, that's not important. So those are 10 things I hate about dentistry. If you want to see what dental school's really like, check this vlog over here. And if after this video you still want to do dentistry, check out this series here where I go through how to get into dental school. Hope you guys enjoyed.